saving all mothers and babies. In 2021, the U.S. had one of the worst maternal mortality rates in the country's history, according to a new CDC report. More than 1,200 people died of maternal causes, which is a 40% increase from the year before. Now, the death rate among Black Americans is nearly 3 times higher than white women. Dr. Niki Rowan with HCA Florida Orange Park Women's Health is here to talk about some of this and what some are calling a crisis specifically in the Black community. You know, I've talked with OBs who say that their Black patients are literally terrified, their pregnant Black patients, about delivering and about surviving that delivery. Do we have a clear understanding about why Black women are more at risk than white women?
I think it really boils down to the fact that the playing field is not really even to start with. So there are lots of things that contribute to that. One of which is that a lot of times Black women may not be as healthy entering the pregnancy as other women. We are more likely to be hypertensive at baseline, more likely to have anemia. One of the major causes of death is bleeding at delivery. And if you're starting off from an anemic level, you're already kind of behind the 8 ball. Another thing is that, you know, our entire society has some kind of systemic issues that we have got to address, including the pay gap for men and women and access to be able to have time out of work and covered maternity time. If you're talking to someone who knows that they're hypertensive and going to be at risk for a lot of these problems, and one of the things that they're going to have to do is some additional fetal monitoring, which costs money, or take time off of work in order to be able to make their appointments and keep their blood pressure down, that becomes really difficult when statistically you may be making 63 cents on the dollar.
Right. I mean, there's a lot of things that are contributing factors as to why we are seeing those numbers. You know, a lot of people hear maybe systemic racism or systemic problems, and they don't necessarily believe that, or they think that we should be able to overcome that. I want to point out a study done by Johns Hopkins in Maryland, and they looked at medical record language, so how doctors were talking to patients, how they recorded what they were saying, and they found that Black patients were less likely to be believed by physicians. So how can patients kind of overcome this inherent bias that, and you have to think, you know, all doctors may experience this.
I think one thing is to make sure that you choose your provider and have the opportunity for prenatal care so that you can really develop a relationship with that person and they can start to know you and what things are important to you and really value you as a person. I think the other thing, because a lot of times childbirth is unscheduled, right? So your provider that you chose may not be the one who's actually on and available for your actual delivery. And so I think there is where doulas can be very helpful, because they can be someone who is that advocate for you and who you do have the benefit of a long-term relationship with, and can kind of work almost as like a translator to whichever provider that you have in that moment, in order to be able to really advocate and help make sure that people are taking your concerns seriously.
And I was going to say, and the other thing is, don't overlook concerns. You know, I've talked with one doctor who says that she truly believes there should be different protocol for Black women, like they should be monitored, their blood pressure should be monitored more frequently. But then on the other hand, if you are experiencing something, you have to really ring the alarm and say, this is serious. And if that doctor's not listening to you, go to another provider or someone else in that clinic that can help you.
Yes, absolutely. I think that some of the symptoms that present are obvious, like extreme pain or heavy bleeding, are, you know, everyone would know to seek care for that. But especially in the time frame after delivery, things like shortness of breath, especially if it gets worse when you're laying down, or now we're seeing a lot more pregnancy-related deaths that are related to mental health issues. So if you're starting to feel very overwhelmed and like you're just spiraling, that is definitely an emergency, and you need to get help for that right away.
So feel empowered. I mean, we put this out there. We don't want women to feel scared, but just know that it is an issue. It is real. You are not making it up, and make sure that you're seeking the help and the resources that you need. Thank you so much for coming in to bring attention to this.
Thank you.